How is metastatic liver cancer prognosis determined? Imagine trying to predict how a complex story will unfold. That's similar to how doctors estimate the outlook for metastatic liver cancer. When cancer from another part of the body spreads to the liver, understanding the prognosis involves looking at several important factors. First, the stage of the cancer is key. If the cancer is only in the liver, the outlook might be better than if it has spread to other organs like the lungs or bones. The more widespread the disease, the more challenging the prognosis becomes. Next, the origin of the primary cancer matters. For example, cancers that start in the colon and spread to the liver often respond better to treatments than some other types, like pancreatic or lung cancers. The number and size of liver tumors also influence prognosis. Fewer tumors, especially if they are small, tend to be associated with better outcomes than multiple large tumors. If the cancer has spread beyond the liver, such as to the lungs or brain, the outlook generally worsens. The health of the liver itself is another critical factor. Patients with good liver function and no underlying liver disease, like cirrhosis, are more likely to tolerate treatments and have a better chance of survival. Age and overall health also play a role. Younger, healthier individuals often have better outcomes compared to older patients or those with other medical conditions. How the cancer responds to treatment is also vital. Some patients see tumors shrink or disease slow down with therapies like chemotherapy or targeted treatments, which can improve prognosis. Blood tests that measure tumor markers, such as alpha-fetoprotein for liver cancers, can give doctors clues about how aggressive the cancer is and how it might behave. A patient's ability to perform daily activities, known as performance status, is another important indicator. Patients who are more active and independent tend to have better survival chances. Finally, the availability of treatment options influences prognosis. Surgery, liver-directed therapies, or participation in clinical trials can offer hope for some patients. In summary, doctors assess many factors including the extent of spread, the type of primary cancer, liver health, patient age, and response to treatments to estimate survival chances. While metastatic liver cancer often has a challenging outlook, ongoing advances in medicine continue to improve outcomes for many. Remember, each case is unique, so it's essential to discuss your specific situation with your healthcare team to understand your prognosis and explore the best treatment options for you.